History Month at ABAC. We're really excited about all the various programming that we've been able to offer this year. We're about to get started with one of our next main speaker events. Professor Jennifer Koslow. Professor Jennifer Koslow was one of my advisors when I was a grad student at FSU. She was one of the people who kind of mentored me through that program, gave me a lot of advice, and also helped me find one of my true loves, which is public history. So that was a really great connection for me. Her specialty is women's history and public health history, right? Which is why she would be such a good combination for this particular time in our lives. And she comes to us from Florida State in Tallahassee. Everybody give a big welcome to Professor Koslow.
So yes, if you have ever had any complaints with Professor Medley, take it up with me. It's my fault, not hers. So thank you to Professor Medley, everyone here at ABAC for hosting me. Today I'm going to do two things. One is I'm going to discuss the history of women's engagement with public health in the early 20th century. And I'm sorry for those, I'm a little short that you can't see me. And I'm going to do that by really using Los Angeles as a lens for talking about these issues at the turn of the 20th century. So you're going to hear a lot about Los Angeles, but I want you to think about how some of those same ideas could apply to where you either grew up or living here in Tifton, either one. So two things here. A lot of this will be about public policy. So for any of you who are do we have folks who are interested in going into public policy maybe? Making laws, there you go, 1, 2, 3. So you'll find connections here, and for those of you who may not make a career out of public policy, you spent I was just saying with Professor Medley, it's been 2 years, right? My kids came home for a spring break and they never went back. So we've done a lot of thinking about public policy in these last 2 years. So you're going to hear a lot about how that is made, how that was constructed in the beginning of the 20th century. And because it's Women's History Month, we're going to focus on how women participated in creating public health policy for themselves and for different communities that they were working with, and how those communities, the patients, also shape public health policy. So it's about the policymaker and about the people who use the policies. So, in the early 1900s, most women experienced the rigors of childbirth at home. That's true until the 1940s. Most women gave birth at home. But who could they call when complications occurred? This image, I don't have an image of the tale I'm going to tell you about the 35-year-old Russian woman, but these pictures are illustrative of what's going on. Here, this woman is Mexican-American. So the tale I'm going to tell you is about a 35-year-old Russian woman. And she failed to regain her strength 2 weeks after giving birth. So her family, instead of calling a physician or a midwife, what they did is they called a social service agency. They called the Los Angeles College Settlement Association, and they sent a nurse. Upon arrival, at the Russian woman's home, the nurse assessed the patient as having made a very poor recovery, was anemic, running at little temperature. And so the nurse tried to apply the protocols that were set forth by her supervisor named Maud Foster. And what the nurse tried to do was convince the patient to go to the hospital. The family, however, quote, positively refused to allow this. And the response probably did not surprise the nurse because there was an aversion to hospitalization by the working classes throughout the entire nation during this period. So despite her supervisor's directives, so it's one of these nurses and that's her supervisor, the nurse called for a physician. who then leaves medications to be administered daily. But the patient wouldn't take the medications unless the nurse was actually there. And so the family, after 2 weeks, was, quote, very much dissatisfied because the patient wasn't improving. This frustrated the nurse because she felt it was the fault of the family. She resolved the issue by threatening to never return, quote, unless they would do as they were told. And presumably because the family did want help, they complied. According to the nurse's account, it took 2 months of, quote, hard work on her part for her to finally see a recovery of this 35-year-old woman. The nurse ended her report by stating, quote, "We have gained the confidence of the family and they know this was done for the welfare of the patient." The nurse restored the patient's health, but her assistance felt obtrusive and engendered suspicion. So the creation of social services at the turn of the 20th century brought life-saving help into people's homes, but it was also mainly the result of private, non-governmental initiative. In the 19th century, cities did not have public health care systems. Instead, they relied on medical practitioners and private practice and civic-minded citizens to donate their expertise and money in times of crisis. Women often directed disaster response efforts, whether it was attending to patients during the Civil War, and this is Clara Barton, who reorganizes hospitals during the Civil War based on the ideals put forth by Florence Nightingale. Or you see this in the case of Chicago after the fire of 1871, that women were the one who organized relief efforts for citizens. But by the end of the century, public health projects became reactions not only to catastrophic disaster like fires and war, but became part of a broader development of urbanization. Unchecked urban growth, people realized, resulted in contaminated food supplies, it resulted in substandard housing, it resulted in lack of access to medical care. In the absence of regulatory protections, working class families were particularly vulnerable to these quality of life issues. So these environmental and social crises sparked a surge of reform across the nation with women leading the way. They formulated professional responses, but instead of rejecting a role for government in advancing an individual's everyday existence, they embraced it. And that is fundamentally different than the way we function today. They embraced government. They wanted to increase the social capacity of government to be able to respond to both everyday problems as well as catastrophic ones. So by the end of the 19th century, citizens were realizing that municipalities should have some responsibility for taking care of the public's health. That most often happened in epidemics, but we begin to see also large-scale projects such as sewers, aqueducts. This is the New York City aqueduct. It was built in 1848. It was considered the marvel of its age. It brought water, fresh water from the Bronx into Manhattan, and you can still see part of the aqueduct still exists today as a bridge that you can walk across if you go to New York City. So with these large projects, cities demonstrated their willingness to create things to protect the public's health. So the primary justification for these ventures were the need to combat dirt. So 1848 is when that is created. that is before the germ theory. So before the germ theory, people believed that dirt somehow in the ground created this, they were called effluvia, but basically this gaseous, noxious smell that then would infect you, and it was called a miasma, and you couldn't really escape it. And there's a grain of truth to this. Many of the microbes, like cholera, that microbe loves dirt, right? That's a good area for it to grow. Same with polio. So, but in the 1880s, scientists, and on the top is Pasteur, on the bottom is Robert Koch. Pasteur is from France, Koch is from Germany. They begin to figure out that microscopic organisms, particularly bacteria, they haven't figured out viruses yet, but they figure out bacteria first, cause disease. And the first major one that gets identified is tuberculosis in 1882. And so this germ theory, for a while, sits together with people believing that dirt causes disease. It's not immediately revolutionary. So the two theories of what are the origins of disease exist at the same time. And they both motivate actions. But by germ theory, you begin to think, okay, maybe we don't need all of these large-scale projects. Maybe if everybody washes their hands and everybody engages in sanitary behaviors, we won't need these large-scale efforts. Truth is, you probably need both of those things, but that's what they were thinking. So women seize on this opportunity where there's this ambiguity between what causes disease to agitate for bringing medical care into people's homes, as well as agitating for the state to take on a more active role. Reformers argued that citizen volunteerism should be aimed at securing state responsibility, and they offered solutions to the city for public health problems. And this is in the absence, there's no federal public health. There never has been. It's always been local, and that goes back to British colonial law. Public health is always a local matter, and the most it sort of became was a state matter. But it's always been local. That's where the laws are always written. Sometimes they're written at the state. It's never the federal government, was never the federal government's responsibility to provide for public health. So these municipalities then become really, really important because that's where state making happens. That is where citizens create political structures to produce social order. So the reformers' goal is to involve government, and the idea of public health that they wished to see implemented was one that they were going to create and then have government take over, not the other way around. And so what we see with this Russian family that I told you about is that there's these exchanges going on between the reformers and the families using the programs. And so in those exchanges, in those pieces of negotiation, is where you're getting public health created at the local level. Now, back to that beginning picture where I showed you Maud Foster. Maud Foster was a middle-class woman. And she, like many other middle-class women of this time period, are the ones who foster this approach of creating public health programs that provide medical care. They're doing that, not city officials. So, what are they using to do this? They're using, Maud Foster is using this idea, what we call maternalism. And that's what they sort of called it and what historians have labeled it. And maternalism is an ideology that associates women with the home and the family. And so these middle-class reformers argued that because, it's sort of this ironic argument, they argue that because they are women, that they will understand the family better, and therefore they should be engaged in creating public policy, which by its very nature takes them outside of their homes. Right? So it's that power, and they're arguing that they're nonpartisan. So to say you're nonpartisan means that you don't belong to a political party. So political party, today we have Democrats, we have Republicans. That hasn't always been their case. There have been other political parties as well over time. But that's when they say nonpartisan, when we say nonpartisan, that's what it is. They don't belong to a political party, but they want to engage in politics. So, this isn't the only thing that shapes their outlook, though. And I want us to understand that their beliefs about disease, urban space, racial prejudices, and class biases all converge in the types of public health policies they are creating. So one other thing about this time period that you may remember if you've taken a U.S. history class is the late 19th, early 20th century. There was a tremendous amount of growth in terms of industrialization. And so capitalism was fairly unchecked. We don't have an income tax, and even the income tax we did get in the 19-teens is not very big. So you get things like the Rockefeller, the Rockefellers, the Carnegies, that unchecked capitalist growth is going on in the background here. So this happens throughout the 19th century. Whether you're in Chicago, whether you're in Atlanta, there are these reform movements. But the reason I like studying California, and particularly Los Angeles, was it was a hotbed. It was stronger than so many other places, which is kind of amazing. And just to give you an example of the reformist impulse that was going on there, there's this book called Looking Backward, where this man falls, he bumps his head in 1887, he wakes up in 2000. And it's all about utopia. He wakes up and there are these umbrellas, which is great because of today. So think about today, people have individual umbrellas. But in this book, the idea is there's one umbrella and you go outside and you go from building to building because there's one giant umbrella, which is a symbol for this sort of socialist utopia. And this is socialist. The book was all about socialism. So this inspired people to create clubs based on this book, which they read, which when I've given it to students today, they have not wanted to create clubs. But it inspired clubs, and people wanted to try to realize this socialist utopian vision, and nowhere were there more clubs, these are called nationalist clubs, than Southern California. That had the most in the entire nation. Other than that, Los Angeles, in 1903, it created a referendum initiative and recall. So what we call direct democracy. So we are all familiar in Florida with these categories. But in California, I kid you not, they give you a booklet because there's so many things that people want to put on the ballot. This was seen as progressive. The prohibition of alcohol was a progressive cause, culminates ultimately in a constitutional amendment. Los Angeles County was dry in 1907. And then finally, women in California were voting for the president in 1911, 9 years before the 19th Amendment was ratified. So Los Angeles was a hotbed of reform. I know in the question period, some of you might want to know, why was Los Angeles this hotbed? Well, that is like there's been history after history trying to debate And there's no conclusive answer as to why. Well, where is Los Angeles? Very far from us. This is an image of it is in 1850. If you've seen any Hollywood movies of the Southland, it looks very different. But it was settled by the Tongva, and then it was colonized by the Spanish in 1781. It was ceded to the Mexicans in 1821 and conquered by the Americans in 1848. Until the 1880s, it was a pretty small space. In 1850, for instance, the way in which they dealt with public health issues was every person who had a domicile was supposed to sweep in front of their domicile. And that was what they did for public health in 1850. By the 1880s, this changes. So in a single decade, the population grew from 11,000 to 50,000 in one decade. People were attracted. It was only 29 square miles wide. It's not very big. But there was real estate, opportunity to do a quick fortune somehow. People were going there because they thought the climate would cure them of tuberculosis. So it was a boom, like a big boom city in the 1880s. At the end of the 1880s, there's a smallpox epidemic. In 1887, there was a smallpox epidemic throughout the entire nation. You might have heard of New Orleans. Actually, Florida had it as well, 1887, 1888. And that caused Los Angeles to rethink its public health policies, and it creates a new city charter, and what it does is creates a permanent health officer and a permanent board of health. So by 1930, it just keeps on growing and attracting more people, and by 1930, Los Angeles was the 5th most populous city in the nation, and there were 1 million people there. So the work that these women are doing that I study is against this backdrop of tremendous growth. And it's not the growth physically of this city, well, that happens a little bit too, but it's growth of population. All right, now, and this gives you a sense, this is it in the 1890 of how much it had grown. Civic boosters sold the city as the land of sunshine. That was their big thing. But the health records demonstrate that was not always so sunny. Recent immigrant workers whose labor was sustaining this tourism and agribusiness encountered conditions of poverty in Los Angeles very similar to their counterparts in eastern and midwestern cities. And these epidemiological studies that what they would do showed that there were issues. Out of empathy and fear, reformers and public health professionals monitored immigrants' health, and their findings are later used to justify immigration restriction in the 1920s. So place and race played determining factors in public health in Los Angeles. It was seen as multicultural almost from the get-go. Mexicans, Japanese, Chinese, Southern and Eastern European immigrants lived as neighbors. It was not the sprawling metropolis that it is today. People were packed into the 29 or so square miles. This actually comes from the health department, where they were trying to remark on all the different immigrant groups that they had, that they were encountering. And you'll notice they have put, we don't know if it's a Japanese baby or a Chinese baby, but they put that in the focus of their picture. So there's all these stresses on urban growth. The health department sort of tries to answer them, mostly through regulation. And they begin to notice they have an issue of mortality. And mortality statistics are something that once you start to to issue death certificates, you can figure out a little bit better what's going on in your public. And on top of that, once you issue birth certificates, you find out even more information. So death certificates and birth certificates are something that's created in the late 19th, early 20th century. Before that, to prove that you were born, you often had a baptismal certificate. So the creation of these documents by the state, we often talk about, oh, it's just so easy to get a birth certificate. Well, some people who were born between 1900 and 1940 at home didn't necessarily have a birth certificate. They might have still used a baptismal certificate to sort of work as their primary document of proof of who they were. In Los Angeles, what we begin to see is a mortality rate that was between 11 to 15 deaths per 1,000, which wasn't terrible, but it wasn't great either. More worrisome was that when they start calculating the infant mortality rate, and that becomes the way that cities compare each other, they realize that it's 168 per 1,000 live births. The average in 1890 for the entire nation was 150.7. So it was above the national average. Today, it's 5.1 in Los Angeles County, although for African Americans, it's double that rate. And that's one thing that the statistically, minorities always had a higher infant mortality rate. And then the last category, when you look back at the documents and you calculate all the diseases that we know were bacterial, 44% of all the deaths in Los Angeles were caused by contagious diseases. And they recognize it not to quite the same extent. They calculated for what they called zymotic diseases. I'll talk about that in a second. They calculated 24%, but really they were dealing with 44%. So it's against this backdrop that in the 1850s you begin to see some volunteer organizations, just like I showed you Clara Barton, just like I showed you Chicago. In Los Angeles, the first one created was the Jewish Benevolent Society, then a Catholic organization, the Sisters of Charity. They create an infirmary that was open to everybody, and then the Episcopal Church created their own hospital. And what you begin to see is the formulation of benevolent associations creating health services, but only for particular groups. Except for the Sisters of Charity, every group sort of created its own facility. So the most important secular organization to provide public health services for the city's residents grows out of a women's movement. So that first picture that I showed you of the nurses, that's the Los Angeles College Settlement Association. They owed their origins to this women's club called the Friday Morning Club. And the one side here is Caroline Severance, and that's an image of where they met. Caroline Severance came from Cleveland. Her family was engaged in industrial work, i.e. owning. You can think about steel. The steel industry is Ohio. And she was considered the mother of all women's clubs. She created one in Cleveland, and then she moves to Los Angeles. So it is at the Friday Morning Club that we begin to see the creation of sort of a consciousness by women that they should be engaged in reform. It was private, however, you could invite your friends. So let's say you guys are the Friday Morning Club. Each one of you gets to invite 3 guests who are not paying due members. There is also a way that men could come to the women's club as well as other outside guests. So it really becomes a place where women create a public forum for thinking about social, economic, and political issues of the city. You could go And you could hear about the property rights of married women in California, which if you think about the Friday Morning Club, which is a bunch of elite and middle class women, this might be very important to them. You could watch Mrs. J.H. Padzicki and Ms. Wade, employer and employee, actually debate domestic service and how to remove prejudice against it. Or you could listen to Sandra B. Monk's talk about studies with a microscope. So all of these different talks that are going on were very diverse, and they could pique the curiosity of any member. And at the same time, what they're doing is legitimizing women's concerns beyond homemaking and the arts. That this club could be a way to form a political consciousness. So in terms of public health, we have to go to this meeting, which was on February 2nd, 1894. By all accounts, it was supposed to have been just a routine meeting. This is the year after 1893. There's a huge recession in the United States. Some things that happened in 1894, or at this time period, you can think the big Pullman strike happens. You might remember that from your US history classes. In the Friday Morning Club, they meet to hear about the, quote, unemployed. And Sarah Longstreth, a member, provides statistics about men and how to figure out which men are unemployed and worthy and which one of them are tramps and unworthy. And they're talking about this at the meeting. The newspapers go, but they're really interested in the two guests who get up to speak impromptu at the end of this discussion about the unemployed. And they are Jane Addams from Chicago, perhaps the nation's most famous female reformer, and James B. Reynolds, who if you lived at the time and you were engaged in reform, you would know who he is. He actually becomes very important. He works on issues with Theodore Roosevelt for public health issues. So the press, they report on this, and they describe Adams as magnetic and delightful speaker with luminous eyes and a fine face. And Adams discusses how Hull House in Chicago carries out public health work and educational projects. Reynolds, who the newspapers declined to talk about his physical features, right, unsurprisingly, he was the head of the New York University settlement, and he does something that really ticks off the local press. He starts lecturing the women at the Friday Morning Club because, and this is where it differs, one paper says that they asked him for his impressions of Los Angeles. The other one says he just started talking without any prompting. But he insults the city. That's what he does. He goes, he says that Los Angeles was more deplorable than anything he had seen in the cities of Europe, Asia, and Africa. So the Los Angeles Herald and Los Angeles Express, well, the Express said he was, in the parlance of the street, talking through his hat. But the Friday Morning Club members didn't seem to be offended. In fact, within weeks of their visiting, a small splinter group of women who had gone to Wellesley, Vassar, Oberlin, and Northwestern, who had already organized themselves into the Collegiate Alumni Association of Los Angeles. So this is women with college education or some college education forming a group. They create the Los Angeles College Settlement Association, which then will create this nursing, public health nursing program. What is happening here is that these women, whether they're in the Alumni Association or in the Friday Morning Club, are part of a transatlantic movement that Reynolds is a part of, that Adams is a part of. If you go to New York City, Lillian Wald is a part of. They're all trying to think about how, as private citizens, they can inform public structures. The Los Angeles College Settlement Association was not the only group to do this, but they're the ones who exerted the most influence on the city's health department itself. And they always use their avowedly sort of secular nature to argue that there was a role for them in providing medical care. Each foci of reform that this organization, the Los Angeles College Settlement Association, worked on, whether it was public health nursing, housing reform, childbirth services, they also worked on venereal disease programs, issues of milk, everything that they did, but in particular these three, they then are able to create a program that the city health department will adopt, just like an entire program, sort of like, here, have a program. But their first idea was public health nursing, but even they would admit that there were times that they didn't recognize public health issues in their midst. And so we see Jacob Reese come to town, and here's a picture that he did of a New York City tenement on the left, and on the right was what was called a house court. And what was hilarious when I was doing this research was I lived in a house court. And I'll show you what a reformed house court looks like in a second. But Jacob Reese comes to town and they realize, wait, our tenements don't look like the New York ones. They're not multi-level, but they're flat and they're the same kinds of conditions, the lack of access to bathrooms. How much air are you going to have per structure? How many windows? How many people live there? All of those were remarkably the same. Same with milk. So Florence Kelly, who worked out of Hull House, comes and they're sitting at dinner. She's come to talk about industrial conditions. And she asked her host, where does your milk come from? And reformers originally thought, well, the milk doesn't come that far from Los Angeles. We don't have to worry about where it's produced. But in fact, they did. And so this set off a whole discussion about whether the milk that they were getting was healthy. And you can think all of this, many of these things are about consumer rights, right? The bigger the city, the more distant you are from the production. So right, when you go today to the supermarket to buy a gallon of milk, what farm did it come from? Do you know? I don't know. Thank God it's pasteurized for the most part, so you don't have to worry about that. But this is before pasteurization takes off. And so this question of, well, where's your milk come from? I don't know, right? And then you can see I love this cartoon because the little hose pumped into the baby, right, with the end product there. So all this to say is basically these reformers started rethinking what they thought were Eastern problems and looked at the West and they said, wait a second, Los Angeles has in substance the same problems. They just look different. Now, the other thing is that women in Los Angeles also, because of the germ theory, begin to use microbiologic discoveries to argue for change. So they're both using sympathy, right? This was supposed to stoke sympathy. You don't want the little baby drinking the milk and dying. But they're also using science at the same time. What ends up happening is the Los Angeles College Settlement Association women create a public health nursing program, which is to bring a public health nurse to you in your home when you were not feeling well. Imagine how great that would be if every time you thought you had the flu, right, someone could come to your house rather than dragging yourself to urgent care, right? So this is what this was supposed to do. It was supposed to bring someone knowledgeable about healthcare into people's homes. They also create this housing project, and they hire a female inspector because they thought most women are the ones who are going to be home. So we should have a female inspector going into the homes to talk to the women. And this is what an improved house court looks like at the end of it, right? Where there's spacing, it's clean. Theoretically, there's the right number of ratio of privies to people. And the childbirth services, which I showed you at the beginning, where you can see here that the nurse's ideas about order come into play, right? Like she's got all of her stuff, she's made the bed. Now remember, these are pictures that they've taken to make an argument. And the argument is that immigrant women don't know how to take care of themselves. That is the subplot to their picture, right? And they've staged it. So I want you to always interrogate photographs that are created by a particular organization, because sometimes like this they are staged to tell you a story. All right, so I want to go just a little bit more in depth about this public health nursing program. And this is, right, their identification of themselves on duty here. What makes Los Angeles unique was that they were the ones to convince the city council to give them money in the entire nation. So other public health nursing programs relied on private money to be functional. In Los Angeles, they didn't have enough money they had enough money to get a piano. They did not have enough money to pay $50 for this woman to go into people's homes. So they convinced the city government to come up with a $50, $600, which was a significant amount of money. They got more than every other charitable organization asking for money from the city government. And they had the support of the city health officer in doing this. Eventually it grows from 1 to, you can see here, 3, and then there's an additional 2 who did school nursing. So the program grew over its 16 years, and the settlement you can see in the back there provided the facilities and the equipment to conduct outreach to the city's poor, while the city provided the money. So what did women think about this? Overall, these women they counted 21,749 patients, and they made a total 100,246 visits in their 16 years. They mostly dealt with cold sores, minor infections, but they also wanted the nurses to recognize what they said were cerebral, those things that cause fevers, and zymotic diseases, which we would call today contagious. Whether it was miasma or germ didn't really matter to the nurses. The goal was not for them to diagnose, but to be able to recognize this gamut of diseases, to then be able to realize if they need to call a physician, or whether they themselves could handle it on their own. So, maybe this will work. You can see here, this is the Los Angeles River. It runs through their area. This is downtown Los Angeles. If you've ever been to Olvera Street or something, that's up here. And then, what else can I show you? Los Angeles River is always famous now because it's cemented. So you'll see it in movies as that, like it was in Grease when they do that. Does everyone remember the scene in Grease where they're racing the cars? No. It was in The Walking Dead, too, in a recent one. It's used a lot in movie sets where you'll see that concrete with a little water. It used to be an actual river. But this is what their territory was. They mapped it out. It was only about a mile wide and about 3 miles in length. Now, these were the people that they saw as their clientele or patients. And they recognized that they were working with a diversity of populations. The only thing that was common was that most of them were either minorities or immigrants. The majority of their patients were Mexicans and Russians. They believed their perceptions of race. They believed that Mexicans were affable and would sort of follow directions. They believed that Russians were stubborn and really frustrating. And that perception colored every interaction they did. So what did it mean for these women who are using? Well, I told you about that opening vignette, right? The 35-year-old Russian woman who they finally exceed, and the nurse is like, I did it, right? But not everybody did that. And so I wanted to tell you about another woman who found her own way, who really didn't want these people here, who saw them as busybodies. So a nurse was called to the house of Mrs. W, who had given birth in the last 48 hours. So remember, these nurses are going in these communities, and so they are eyes and ears. So they are looking and watching. And they see that this person has had a child, and so the nurse goes and discovers that this woman, her husband, has left her 3 months before. And she's been moving from family friend to family friend. She also has a 2-year-old. The nurse wanted to wash and clean Mrs. W to prevent infection. That's a good idea, right? But then she gets irritated. The nurse gets irritated because the woman obstinately refused until told that she would not be reported to a policeman and taken to a hospital. So the woman was immediately suspicious that the nurse was going to force her to go to a hospital, and she did not want to do that. So the nurse wanted to make the bed too, and the woman didn't want to let the 2-year-old out of the bed. And then the nurse is like, but I can't make the bed with you and the 2-year-old. I can't do it. So she leaves. And she recognizes, she says, in retrospect, she realized that the woman, Mrs. W, was afraid that if she let the child, the 2-year-old, be taken from her, that the 2-year-old would be taken away to child welfare services. But the nurse didn't really understand her role in the miscalculation here. So she comes back, and the nurse says, well, she's really fond of this 2-year-old. I don't know how much she cares about the baby. Then she comes back for a follow-up visit 5 days later. And where is Mrs. W? She's not there. She has gone visiting. This really ticks off the nurse because the woman had left her baby with the friend who was there, who had also recently had a baby. And she uses the term, she says, she had left the newborn with the woman she was living with, knowing this woman would feed it, having been recently confined. Now, for middle-class women use wet nurses all the time. But it was not okay for this working-class woman to be doing that, apparently. And so the nurse goes and reports the woman to the Associated Charities, so that Mrs. W's fears were realized, right? Like, here's the state coming into my business, and, right, it's going to do me harm. Now, what the nurse, if you read this from a different angle, you can say, well, Mrs. W never asked for the nurse in the first place, and she had made arrangements with another woman in a similar situation. She felt well enough to go visit somebody else and had made childcare arrangements, right? So when you're reading documents, historical documents, never take whatever that person is telling you. If it's a report of a nurse telling you about her work, you have to always say, is there another way to look at this document? Can I read against the grain? Because when you do that, you're like, okay, well, yes, having this person come into the house and help you when help is asked is great. Having the state come into your house and judge you for decisions that you're making about your child who's being taken care of is something altogether different, right? And if anyone has a 2-year-old, like if I say, hey, I'm going to go somewhere and I'm going to leave the 2-year-old with Professor Medley, that 2-year-old may not be so thrilled about being left behind, right? Attachment issues. All right. 16 years after it's created, the Los Angeles College Settlement Association decides it's had enough, and it decides to convince the city government to pass an ordinance to establish a Bureau of Municipal Nursing within the health department. And there it exists, and in the 1930s, there's reformulation, retabulation, but out of this grew nurses within the public schools, and then it came back into vogue, and now there are city public health nurses again in various cities and in Los Angeles. So in conclusion, female reformers left a legacy of expansive public health service. Although in many cases, like the housing program did not survive the Great Depression, childbirth services, eventually everybody moves to the hospital and you're no longer giving birth in homes. But at the time, these women changed what was a civic expectation, and they changed everybody's attitudes about what the city could do. And so rather than just responding to epidemics, it could be proactive and actually offer health services. At the same time, we always have to understand that their perceptions of race, class, gender, ethnicity shape their programs. Sometimes in positive ways, sometimes in what we would say, looking back, in negative ways. Overall, though, these women wanted to create the state, not break the state. And that is 45 minutes. So I want to make sure I leave some time for questions, either about this, or if you have questions. I know my head right now is we're on spring break, but I've been teaching about pandemics all semester. So I've done yellow fever, influenza, we're about to head into polio. So I'm open to any questions you have about women, disease. Yes?
I know that in this time period there weren't many professions that were considered a woman's profession, maybe teaching as one, but would you say that this push for more women to go into the nursing field and make that more so a woman's profession as seen in that time?
Yes, and nursing itself becomes professionalized. So back in the Civil War, what I first showed you, many people, women had always nursed. That had been the gendered expectations of families, that women were nurturing, women should be the ones attending people who are sick in the homes. But there was a difference between that and going to a nursing school. And so after the Civil War, you begin to see the rise of actual nursing schools that develop. And so everybody she hired here had a degree. And Foster, who didn't have a degree herself, she went to Wellesley for a little bit. She did like 2 years. Everyone she hired had to have a nursing degree. Now that also limited things too, because African American women, there were very few nursing schools open to them. So you see that race did matter in how far that field was opened up to people. And then there's also female physicians. So one of the things that happens, like that collegiate association, like people from Northwestern and Wellesley and Smith, and even Jane Addams had a college degree. One of the things that happens in the 19th century is when you don't need everybody working the farm, or you don't need everybody working in your building shoes in your house or whatever it is, one of the luxuries of being middle class was being able to send your daughters to college. And that becomes a signifier that you're middle class, that you don't need your kids' labor, that you can send them to college, your girls. And so there's a rise in the number of women at the end of the 19th century who have college degrees. And some of them then push to go into medical school. And for a little while, between like 1890 and 1930, there's a significant number of women who are able to get MD. And then the profession changes, and women are literally told there is no place for you here. And so they're pushed out, and then you don't see the number go back again until the 1970s. But so some of these college-educated women become lawyers, some of them become physicians. Nursing was another profession that people did. And so those all sort of exist at this time at once.
Sort of made that change in the, there's no room for you here as a female, as a doctor. Was it any one thing that sort of made that tide change?
Three major things. One is they changed medical education. So medical education in the 19th century was like 2 years, or you could go apprentice. And if you went to some college for 2 years, like let's say you decide, I want to open a medical college, you could, right? Like there was no regulation. It was sort of like the Wild West. And you got all the money. So you opened the medical school and you got the money for the students. So there are all these people with medical degrees, probably shouldn't have medical degrees. And then you could also apprentice and become a physician that way. That was the first major way. And then there's this notion, so some of the people who do have university education are like, I don't think we like this so much. We don't like all these proprietary schools. And so they lobby at the state level to have regulations. And so you begin to see medical schools change, and to be a licensed physician, you had to get a degree from an accredited school. And so then you get that graduated, one, you had to have an actual undergrad degree to go to medical school, and you had to do what was a graduated course of 4 years of medical school, something that looks like what we have today. And then they adopt from Germany the idea of using science and a microscope. And they argue, there's arguments made that women before, that they made natural physicians, because to learn to become a physician was an art. You looked at a body, you looked at the things coming out of the body, and you sort of figured out what was going on. Now we're going to use a microscope. And if you teach women how to use a microscope, they will become sterile and never actually they won't want to give birth to children, right? Like, so there's a total argument, right? It was all about nature, the natural body and women, and truly believing that women, if they learned science, that their ovaries would shrivel up. So they start saying, like, women can't go, like, we're going to do quotas, and they just can't go to med school because we're doing it in their best interest. Now, there were 2 or 3 medical schools open to, like, just women's medical colleges that stayed open, but most medical colleges shut their doors. Plus, California, because they were state funded, had to provide opportunities, but they did quotas to keep them out. So it was the combination of all those things coming together. So I know, it's fun reading that stuff. They're like, oh, women, they can't, they learn books, they're like, just swoon. I know. Somehow that's not the case, but some of them truly believe that. They truly believe it.
And they call themselves scientists.
Right, they truly believe. Yes?
So after doing research about California healthcare, specifically LA, and she said you probably looked at New York as well, area stuff.
time period, yes, the federal government did the federal government didn't collect taxes until 1916. So they did tariffs. The federal government sort of collected money that way to fund itself, but it really didn't do a whole lot that engaged the individual person in society. And so all of the rules about how you would respond to any disease was the local authorities who always have responsibility for that. But sometimes there would be conflict between what the state wanted to do and what the municipality wanted to do. And then sometimes the federal government, the one place the federal government had a role in terms of responding to disease was ports, because that was trade. So in that way, the federal government, they first create something for merchant marines. No, is that right? Yes. The people on the ships. Yeah. They create a hospital for them and then you could have the federal government come in and say, and they do this in like New Orleans, they're like, or Pensacola. They could say like, I see smallpox, I see yellow fever, we're gonna close this port. But then the business people in there would get very upset because how do you do business if your port is closed? So at this point in time, it's not really a federal versus local issue because the federal just doesn't have a role other than ports. And there is, Los Angeles has a battle in 1924 because there's a pneumonic plague outbreak. It's the last pneumonic major outbreak of plague. And the federal government shuts down the port and the business leaders in Los Angeles, they're like, we can't do that. And they're like, but we can. And so, which is very different than today. So many of the things we see today, where we see the federal government today, like the CDC, that grows out of World War II. So all of the NIH, National Institutes of Health, also grows out of World War II. So our current context is much more shaped, less by what's going on here, more what's going on in World War II. But even the CDC can do research, the NIH can do research, but they can't make local law. The most they can do is they can, so probably some of you heard about the OSHA regulations, right? Can the federal government establish that if a business has 100 people or more, that it can establish health regulations, right? So the answer for that is that OSHA can, in many instances, create regulations that are related to health. So chemicals, when we're working with chemicals in 100 or more things, they can set up regulations. So they extended that to masks, but then the Supreme Court said, you've gone too far in this regulation. But that's one place where the federal government can have reached down to the local, but it's through working conditions. But the federal government can't make a rule for Tifton, ever. It's just not possible. It's never been possible, and it never will. Under our system of federalism, will never be possible. Now, whether that's an effective way to respond to an epidemic, that's where all the debate is, right? But so that's why we get these discussions today about federal, state, and local. But the federal actually can't make your rule here.
Didn't the most famous women in history, like Clara Barton, for example, didn't they have nicknames?
I have no idea.
What I'm talking about is, like, I know for a fact that Clara Barton, she earned the nickname of the Angel of the Battlefield because of her way to save soldiers by bringing in carts. That's all I've done.
Yeah, I guess Florence Nightingale, I think it was the lady with the lamp. That's it. Yeah. But I don't think Jane Addams, as far as I know, never had a nickname. What?
She wouldn't have tolerated it.
No, probably not. I think for the press, though, I think one of the things you hear, like these stories that are told in the press, then the press often wants to create a name that people will remember. So.
genesis for our social services today?
I would say so.
I mean, it seems that's where it all kind of started.
Yes, and it's a little different in each city.
Right.
But their argument that the city should be doing this and not private charities, not private organizations. Now, other places do this differently. So like Hull House can't get this, they're constantly fighting with the city, constant. Like they fight about garbage, they fight about everything. And so they stop fighting with the city and they go to the state to make laws. And then what they do is they're like, well, this doesn't work so great either. We're going to make something at the federal level. So like Hull House has a direct connection to our welfare system. They create a child welfare department at the federal level because they can't, the politics at the local and state level are too onerous. They just can't do it. But in Los Angeles, they were like, okay.
Is that because they were just at a different place in terms of development, whereas Chicago might be a bigger city with a bigger political machine?
It's a great question. I don't know. I think one of the things, and it's in my, so Maud Foster, she actually marries someone named Weston. Her whole family lives in Los Angeles, and what you begin to realize is like her brother is big on doing industrial things, and so they're all kind of connected. And so in that way, I think that's one of, like, I think part of what happens here is that her family and what becomes personal becomes political, and so she gets that support. But for me, I think, yes, this is a model for the city adopting these things, embracing them at an early period, and realizing it works.
I have a question about the services they're providing. So I know that this is where we're talking about like access to birth control. Margaret Sanger is all kind
They
of.
don't go that far.
They don't go that far. They're not talking to women about that at all.
No, they do talk about venereal disease, and they do provide services. They do provide, before World War I, they forced some women to have treatment. So some women who are deemed prostitutes get locked up and are forced to undergo treatment, but then they also provide treatment voluntarily for people. And so that was one of the things. It wasn't birth control, but it was a result of sexually transmitted disease. So in that way, they do engage in that conversation. But the other one, no.
How did you develop your passion for this subject matter?
I was interested in, so before I went to grad school, I read a novel called Sister Carrie by Theodore Dreiser. And it made me want to know more about the late 19th, early 20th century. So that's actually was like a novel that got me into this. And then I just loved cities. I grew up outside of New York City and in a small suburb with 15,000 people. You could walk, could walk from one end of the town to the other, and often did as a high schooler. You know, it's like you could go out, you just walk to your friend's house. So, but New York City was always nearby, and it was always this city. And then I went to Madison, Wisconsin for my undergrad. And I was like, wow, this is the smallest place I didn't really count Tenafly as small, but I was like, this place is small. And then I met a girl from Mankato, Minnesota, who's like, this is the biggest city I've ever lived in. And after that moment, I was like, I love cities. I love studying different cities and people's perceptions of different cities. And then, why disease? I took a course on public health and history of medicine. It had been something that my grandfather had studied, and I just wanted to get to know, he was a physician, and I wanted to understand better what his interests were. And then I found that the things all sort of came together when I was looking for a dissertation topic. And I've kept studying disease, so my second book is all about public health education, where people would do, I mean, you think about it now, you go to the bathroom, there's a flyer. You go to a restaurant, there's a flyer about how you're supposed to wash your hands, sneeze into your elbow. So I was looking in the early 20th century, what happened before there were movies? How did people communicate this stuff? And they would do displays. So you would go down Main Street of Tifton, I don't know where that is, but like not the new mall strips, but the old part of the town. And there, like the central department store would have a display, and it would talk about spotting flies, washing hands, how to bathe a baby, how to protect yourself from disease, and do that individually. And so so I've kept studying disease. And my next project, I'll be looking at Florida and the ways that public health was used to, we call urban renewal. So you mow down areas that you think are substandard and either create a park, a post office, a school, or you sell it to private developers and they create something else. So I'm going to still be going with public health and how it's communicated. So that's where it kind of came from and went. And I haven't done you often research where you are, and it's very hard to research Los Angeles in Tallahassee, Florida. At least effectively. I mean, I guess I could move there every summer, but I don't think my family doesn't really want to do that. So I've moved on to Florida. Well, thank you.
Thank you so much, everybody.